Coronavirus acute pulmonary syndrome, also known as CAPS, is an acute respiratory infection that can progress to pneumonia and acute respiratory distress syndrome. The virus has existed in the fruit bat population for many years, a mutation-enabled human infection, leading to one or more spillover events to pig farmers. A further mutation in the CAPS virus later enabled efficient human-to-human transmission.
Hello friends, and welcome to this new video. As you can see, we are recording from a beautiful location today. We are in a little town on Lake Como. It's called Colico, and it's where I spent part of my life growing up. We've been very lucky with the weather this afternoon. It's been raining pretty much every day since I got here. I'd like for you to enjoy the beautiful scenery before we get to the subject of today's video, which I feel is a little overdue. Please, from this natural frame, without further ado, let's get to it. We are traveling back in time today, specifically to October 18th, 2019. So many events have happened since then, but among these, I feel this one is particularly significant, to say the least, and cannot go unmentioned. Many of you maybe have heard about it or simply dismissed it as a fake news or one of those wonderful labels used so frequently, especially in recent years, to describe anything not fitting the unique officially accepted version of events, also known as narrative, to block us from any kind of further investigation and ultimately from understanding the reality and the world we live in. Event 201, as it was called, took place in New York City, and the main organizers were the Johns Hopkins Center for Health and Security, the World Economic Forum, and the Bill and Melinda Gates Foundation. This event was a high-level pandemic exercise simulation. Using the participants' words, as described on the Johns Hopkins website, it illustrated areas where public and private partnerships will become necessary during the response to a severe pandemic in order to diminish large-scale economic and societal consequences. This, let's call it, training tabletop exercise was based on a fictional scenario. And as you probably have come to realize by now, hopefully, it seems oddly similar to what we all know happened next. Experts agree that it is only a matter of time before one of these epidemics becomes global, a real pandemic with potentially catastrophic consequences. Isn't it incredible how they were so on spot? Look what happened not even 2 months down the road, what we of the Western world had to go through. So as the website continues, a severe pandemic, which becomes Event 201, as they called it, would require reliable cooperation among several industries, national governments, and key international institutions. In recent years, the world has seen a growing number of epidemic events, amounting to approximately 200 annually. These events are increasing, and they are disruptive to health, economies, and society. Managing these events already strains global capacity, even absent a pandemic threat. So who were the participants of Event 201? Well, definitely it was prominent individuals from global businesses, from governments, and from public health. They were tasked to lead the response to a fictional outbreak scenario.
These pictures are from the Johns Hopkins website. You can go check them out for yourselves if you wish. Latoya Abbott, Senior Director of Global Occupational Health Services for Marriott International. Sophia Barge, UN Foundation's Senior Vice President and Head of the New York office. She serves as Chief Liaison with the United Nations leadership and the diplomatic community. Mr. Connett joined Henry Schein in 1997 and is currently president of Henry Schein's U.S. Medical Group, one of the nation's leading providers of products and services to physician offices, urgent care clinics, retail clinics, freestanding emergency rooms, integrated delivery networks, ambulatory surgery centers, etc., etc. You understand what he does. Dr. Chris Elias, president of the Global Development Program from Bill and Melinda Gates Foundation. Timothy Evans, joined McGill University in September 2019 as the inaugural Director and Associate Dean of the School of Population and Global Health in the Faculty of Medicine and Associate Vice Principal. Professor George F. Gao, Director General of the Chinese CDC, Center for Disease Control and Prevention, also Professor in the Institute of Microbiology, Chinese Academy of Sciences, President of the Chinese Society of Biotechnology, and President of the Asian Federation of Biotechnology. A very intelligent man. Avril Haines, Senior Research Scholar at the Columbia University, also Senior Fellow at the Johns Hopkins University Applied Physics Laboratory, member of the National Commission on Military, National, and Public Service, Principal at West Exec Advisors. Jane Hatton, member of the board of the ANZ Bank. Let's not forget, as a side note, that Australia was one of the countries with the harshest COVID policies. Matthew Harrington, Global Chief Operating Officer at Edelman, an industry-leading communications firm that partners with businesses and organizations to evolve, promote, and protect their brands and reputations. He oversees global operations and advises leaders of some of the world's largest and most complex companies on corporate positioning, reputation management, and crisis communications. Martin Knutschel is Senior Director and Head of Crisis, Emergency, and Business Continuity Management for Lufthansa Group Airlines. He is responsible for strategic development of crisis and emergency procedures. Eduardo Martinez, President of the UPS Foundation and UPS Chief Diversity and Inclusion Officer. The UPS Foundation leads the global citizenship programs and initiatives for UPS, and as president, he is responsible for the operations and management of its global philanthropic, employee engagement, and corporate relations programs, which invests in more than 4,300 organizations and communities across 170 countries. Stephen C. Redd is Deputy Director for Public Health Service and Implementation Science at the CDC. He is currently overseeing the Center for Preparedness and Response, the Center for Global Health, the Center for State, Tribal, Local, and Territorial Support, and the Office of Minority Health and Health Equity. Hasti Taghi serves as Chief of Staff Capacity at a major media company. She has worked in partnership with the World Economic Forum. Ms. Taghi has held various roles in hospital administration at Texas Children's Hospital in Houston. She began her career as a news reporter for a CBS affiliate and for an NBC affiliate in Texas. Lavan Thiru, Chief Representative for the New York office of the Monetary Authority of Singapore since November 2016. Adrian Thomas, Vice President, Global Public Health at Johnson & Johnson. He is responsible for global public health programs and strategy addressing global health security threats and pandemic preparedness, including antimicrobial resistance, multi-drug resistant tuberculosis, Ebola, dengue fever, and HIV vaccines, amongst others.
Now let's get back to our event 201. So how did the simulation go? Well, the participants were asked to watch a fictional news report in which a global pandemic caused by the outbreak of an imaginary virus called CAPS was simulated. Maybe, as a side note, we should call it CAPS 19, as we all know very well what happened next. This segment is from the World Economic Forum YouTube channel, which is still up and running, so if you'd like, you can go watch it yourself. And please do take notice that the comments section is strangely and suspiciously turned off. I wonder why. You can find the link to watch the whole video below, and also the link for the Johns Hopkins website. Now, since I'm trying to keep it simple, I chose to speak about one of the 4 segments of the event. It's the one concerning the control of public opinion. In other words, the participants of event 201 discussed how to handle what the people will think, what the people will say, and bottom line, what to do with how they will react. In this segment, you can hear one of the participants mention that Bill Gates is already financing work on algorithms that filter what information you can and cannot see on social media. How interesting! Mr. Gao, the Chinese participant, also talks about measures to be taken to counter rumors that the virus was man-made. But let's get back to a terrifying daily certainty that was plastered all over the place. I'm sure we all remember the data trackers. We all recall them. In the beginning, I remember I was hooked. I woke up in the morning with my coffee in hand. I would open my news feed, and that was the first thing I would look for to see the numbers. Did you ever stop to think and realize how efficient the Johns Hopkins Center was with the data tracker? They had theirs up and running in no time. The COVID-19 dashboard from their Coronavirus Resource Center was up and running only 3 months after Event 201. It started operating on January 22nd of 2020 and finished its activity on March 10th of 2023. It was used to inform the general public, policymakers and journalists across the United States and all around the world with visualizations of deaths and cases as they were being reported. As a side note, the Johns Hopkins Center for Health and Security mentioned that, or stated, that the US government should have been the one providing this from the start. What are your thoughts? Do you think the participants of Event 201 had a crystal ball and saw what the future held for all of us just a couple months down the road? Feel free to leave your comments down below. Let me know. Thank you for watching, and we'll see you at the next one.